Hi, good morning. It's great to be here with you. It's a great event. Thanks for coming. Huge issue. The panel I am going to introduce is about housing and homelessness. We don't have a solution exactly for it, but it's a problem that is uppermost on a lot of people's minds. And I'm going to make a brief presentation about giving you just some basic data and perspectives on how we have been addressing homelessness. And then I'm going to invite a panel of experts to come and talk about their experiences and share their knowledge. So I guess I want to premise this by saying there's something of a paradox in the way that we're dealing with homelessness here in California and in America in general, which is we're not doing very well. You know, there's an increased number of encampments and the visible street population, and there's a growing frustration in that experience. And the irony of it is that we actually know how to solve homelessness for any one individual person. We have solutions to homelessness in particular areas, and yet we haven't figured out how to put it to scale. Okay. I'm going to go through this quickly because I have 15 minutes to tell you everything I've learned in the last 20 years. I can usually do it in 5 minutes, but I'm going to stretch it out because I have to fill the time. So homelessness has been, the way we count homelessness in America, and I'm sorry if I'm saying things that are so well known to many of you, but I'm just laying the groundwork so we're all on the same page. The way we figure out how many people are homeless in America is we do something called a one-night count. It's sponsored by Housing and Urban Development, federal agency that is in charge of housing and homeless services. And they generally conduct this one-night count on the third Thursday in January from around midnight to 7 a.m. That's like somebody on a freight train in a flat car going across the country, looking through a telescope as they go, and trying to describe the topography of the United States. They don't really have a great window of opportunity to really know how many people are homeless. But given the restrictions of that methodology, generally somewhere between 500,000 and 600,000 people are counted as either on the street or staying in shelters on any given night. And that number has been slowly increasing over the years, even as we continue to house people. So the people that we're counting from year to year are not the same people. There's a flow into homelessness. It's not a static number. Generally, 70% of the people counted are individuals. And 30% are families, so that usually single-parent moms with kids. 15% of the population is called chronically homeless, which means they've been on the street for over a year or more. And you can see from this map that homelessness is not distributed evenly throughout the country. It's really the West Coast and Texas and parts of the East Coast, essentially where there is a lot of economic growth and development. And you have cities all down the West Coast, for example. I was in Seattle last week, Amazon building tremendous office buildings in the old warehouse and sort of areas of town that had been industrial and had some affordable housing, now changed over to beautiful office buildings, and the number of people who are homeless goes up. You know, production and progress has a residue effect of increasing homelessness. They're absolutely tied together as more of the cheaper and affordable housing is lost and more people are then priced out of the market because we're not building affordable housing anywhere near the rate that we need to be. And it does change from place to place. Another thing that has become very visible in these larger structural issues around homelessness is the fact that 40% of that population that we count on the one-night count is African American. And African Americans comprise only 13% of the national population. So the racial disparity, in addition to the income disparity, are glaring, not small. This map that came from the National Alliance to End Homelessness is color-coded so that the light gray means that the ratio of African Americans to white is about 2-to-1, and the dark red means the ratio is more than 10 times the white population. So for example, in Washington, D.C., the homeless population is 90% African American. In Atlanta, 85%. This is just the local LA County, 10 years. The number has doubled in 10 years in terms of number of people experiencing homelessness. The homeless population is not all the same. People are homeless for the most part for a short time. They lose a job, there's a fire, somehow they lose their housing, someone supporting them passes away, they're on their own. They may end up in a hospital from housing because they have psychiatric problems and they're in the hospital, and while hospitalized lose their housing and they're back on the street. They might be getting a disability check for $700 a month, but there's no way anywhere in California that you'll be able to put together a first month's security, first month's rent to ever get back into housing. So if you are disabled in any way and you end up homeless, you are essentially priced out of the market forever. And that's the group that is on the street, that's the group that's in the encampments, that's the group that's called chronically homeless. And even though it's only 20% of the homeless population overall, it represents, in the public mind, homelessness. 80% of people you ask about who are the homeless, they will think about this person that they've seen on the street recently. Even though the majority of people who are homeless are in a shelter for a short period of time, bounce back in 6 to 8 weeks, and are out of homelessness. It's episodic, it's brief, and people get back. Those people we don't see. It's an economic crisis primarily, and it's solved by finding a job or a family member that will support them. So the group that we focus on is this group that stays homeless for a long time, and they typically have not only homelessness as an issue, but other clinical problems that just fixing the rent will not fix homelessness. We'll need rent and services. Countries and cities and counties there's a lot of debate about homelessness, and I would characterize one of the main debates about the belief a community has about the root causes of homelessness. There's basically two major belief systems. One is that people who are homeless are there because of something they did, something they chose to do, some mistake they made, some illness they have, bad choices, addiction, mental illness, a list of characteristics that when you read the reports on homelessness can be comfortably attributed to what we would call personal characteristics. Like homelessness is a personal problem. And the other definition of root causes is homelessness as a systemic problem. A problem in lack of affordable housing, a problem in hospitals discharging people to the streets without a sufficient discharge plan, people being arrested while they're homeless and then back on the street only to be rearrested again. A number of different systems, youth aging out of foster care, that don't operate well and people end up homeless. And then we've created this category called homeless, which is really more of a confusing definition rather than identifying the reasons people become homeless in the first place. So one attributes homelessness to personal responsibility, and the other thinks of homelessness as a result of failed systems. And the way you think about it also affects what you do about it. So if you think it's an individual problem, which we did when homelessness first emerged in this country in the 80s, we started to address it as an emergency response. We needed to take care of people. They were hungry on the street, they were cold, so food programs, clothing, the immediate shelter, provide warmth and comfort, were all put in place very quickly as emergency measures, thinking something's gone wrong and we're going to fix this quickly. Well, here we are some 30 years later, we still have homelessness. And those of you who are 30 or under don't know that actually we didn't have homelessness before 1980 in this country. And now it's become part of the urban landscape as if it was always there, which is problematic because that assumption creates a sense of resignation, perhaps, that we're here to actually change and fight. So individual attributions lead to certain kinds of programs, like shelters. And then when people got frustrated with the fact that homelessness was still around, law enforcement became more involved. People were beginning to be sent to jail. Something called hostile urban design was more and more prevalent. They began to put like these separations on benches and metal spikes on in urban buildings, so people would be uncomfortable sitting there, or they couldn't use the space as public living space. The system of care that is designed to deal with individual problems, I would call the staircase model. And this model basically requires people to get treatment because the belief is that their clinical problems led to homelessness, so we have to treat their mental illness and sobriety in order to get back into housing. So you go to a shelter, you follow the rules, you take medication, you maintain sobriety, and housing is offered as a reward or as an incentive for participating in treatment. System works well enough for some. The success rates of that staircase system are somewhere between 30 and 40% in studies comparing it to other approaches. So while it's working for some measure of the population, mostly it's not, and people keep repeating their efforts to try and maintain their sobriety and get to housing, and they cycle in and out of jail, hospital, shelter, and so on. Now, why I say this started in 1980, I think the biggest change that happened from the federal level was that in 1980 we stopped building public housing in this country. This is a graph that shows that in 1981-82 we went from building 350,000 units of public housing a year nationally each year to about 50, where it has remained all of this time through all of the various Republican and Democratic administrations. So do we have a housing shortage of affordable housing? Absolutely. And while nonprofits and other organizations have built some housing for the homeless, that number is estimated to be around 450,000 units in the last 30 years. Another factor that contributes to homelessness is what's called income disparity. This map shows you a global indicator of income disparity. The darker the color, the greater the income disparity in a country. So, for example, in Brazil, the income disparity coefficient is somewhere around 0.7 or 0.8%, whereas in Scandinavia, it's 0.3% or 0.4%. And what's interesting about income disparity in a country is that it's absolutely correlated to the number of people who are homeless per capita. Because with greater income disparity, there are less services, less safety net supports, and so you have greater homelessness and also fewer services to provide for them. In the United States, we've gone from a Gini coefficient of 0.35 in 1980 to we're about 0.55 now. So our income disparity is growing in the wrong direction, and of course our numbers of people who are homeless are increasing, and we're still short on the services. So if you think that homelessness is a systemic factor rather than an individual factor, what do you do? Well, what we did was we created another approach, which is called Housing First, and that approach works from a consumer-driven perspective, which is that we ask clients to participate actively in the formulation and implementation of a service plan. Not surprisingly, when we went to people who were homeless and on the street and asked them what they wanted, almost unanimously everyone said, a place to live. And so it was just a matter of figuring out how to get the rent and the support services that people need after they're housed to put in place this Housing First program. It didn't require sobriety, didn't require treatment, but sobriety and treatment services and health services and occupational therapy and employment services, all of those are wraparound and follow the person once they're housed, and typically through the least, requiring the least effort. Basically, the teams make house calls. So the person goes right from the street into an apartment, and they're followed up with services. If they lose that apartment, the services will help the person find another apartment or place to live. Place to live affordable through the voucher system, which isn't in all areas, so you're looking for places, pockets of affordable housing. So how does that work? How does that work if you put people in housing first as opposed to getting them clean and sober and requiring treatment first? Well, there's been, I have to say, about 4 randomized controlled trial studies of a large scale, some in the United States, 3 in the United States, 1 in Canada, 1 in France. And everywhere you do these studies, what you find is this kind of a pattern. About 80% of the people who go into housing first go into housing. Within a year, everyone is housed, and they stay stably housed. And if you use the staircase model and require sobriety and treatment, even after this graph, for example, goes out 36 months, 40% of the people are housed. So this is a huge difference. It's a real paradigm shift in effectiveness and an approach to working with people who are homeless. This is the Canadian and French study. If you're interested in this stuff, I think the slides will be available. There's about 100 papers written out of the Mental Health Commission of Canada that funded this study in 5 cities. And there was a recent review by the Center for Disease Control looking at 26 studies, 88% decrease or increase in housing stability in Housing First program. So this is what you call an evidence-based practice. It works. It works well across different settings, different countries. This is a conference about collaboration and partnership, and there's a couple of examples I want to give. I know I'm a little over on time, but I'll go quickly. This is probably the most significant and impressive thing we've done in the United States on homelessness and Housing First. We have a collaboration between HUD and the Veterans Administration. HUD put out the vouchers, and the VA put the social work staff on, funded that, and they began to target people who were veterans among the homeless. This was really started under the Obama administration in 2008. There were 76,000 veterans that were counted as homeless in that one-night count, and they introduced this Housing First HUD-VASH approach. And today, if you look at the United States Interagency Council on the Homeless website, 83 cities in this country have ended veterans' homelessness. Ended it. It's quite an intervention and growing. I mean, the thing is not over. We're still working on it. There are cities and counties that have ended homelessness. Recently, I was in a conference last week where Paul was also present. And the city of Milwaukee presented their data. The city of Milwaukee was invited because they had a homeless count 4 years ago that was about 220 people. And on the recent count, this past January, they counted 17 people on the streets of Milwaukee. They had a 94% reduction. And they serve, I think, as an example of what can be done at the local level. I mean, we do this nationally, or we do this municipality-wise or county-wise. They started with Housing First Milwaukee. The Housing Authority was in charge of the program. They would issue vouchers. The Housing Authority hired an outreach team to find people that were chronically homeless. Then they began to work with the district attorney's office to waive warrants so that people could get their Section 8 voucher, not be disqualified. They worked with the court system. They worked with the Parks Department. They worked with the business community. They worked with the hospitals and the emergency rooms so that anytime anyone homeless showed up in any of those portals, they would call Housing First Milwaukee, outreach team, person gets housed. So that shows you the kind of collaboration that is needed and can succeed when you have a community-based approach and the partnerships. One caution is that a lot of people have sort of taken up this Housing First mantra and are calling all kinds of programs Housing First. The fact of the matter is, if you want these kinds of results with 80% housing stability and ending chronic homelessness, you really need to have both the rent subsidy and the services. It's housing first, but not housing only. There's a lot of services that people need in order to succeed in the housing. Okay, so that's my presentation. Thank you. Now it's on to our panel of experts. I'd like to introduce to you Dr. Michael Franzak, who is the Director of Population Health Services for COPA Health from Mesa, Arizona. Heidi Marston. Welcome, Dr. Franzak. Heidi Marston is the Executive Director of the Los Angeles Homeless Service Authority. Welcome, Heidi. And Sheriff Don Barnes, Sheriff Coroner of Orange County Sheriff's Department. Welcome, Sheriff Barnes. Are these on? Yeah.
Are these on?
Sorry?
Test, yep.
Okay. Thank you very much for joining us today. The way we've set this up is to I'm going to ask each of the panelists a question, and then we'll also have some dialogue about issues in general. And I'm going to start with Dr. Franzak. Mike, in your experience in the mental health world, how has using and analyzing data helped improve individual mental health outcomes?
Oh, that's a great question, Sam. I'd like to start with, in the theme of this conference, and a quote from Desmond Tutu, who I happened to see was at this resort at some point in time. Because
can you all hear him? No, Mike, you might have to hold the mic like right directly.
There? Okay. I'd like to start with a quote that I found in preparing for this conference from Desmond Tutu, who happened to actually visit this hotel because he's got a picture on the wall out there, and emphasizing the importance of partnerships in dealing with this problem and hopefully solving it someday. He said, "There comes a point in time when we have to stop pulling people out of the river. We need to go upstream and see why they fell in the river in the first place." And that means that we need to establish partnerships not only to support people getting housing when they're homeless, but we need to stop people from becoming homeless. And leading on to the data analysis part of your question, I work in population health. And so we use big data. We use data from multiple sources. We use data from our health information exchange, data from our electronic record, data from our funders, data from our hospitals to identify factors that are causing, poor outcomes, and homelessness is certainly one of the poor outcomes. But in looking at the data, there's so much of it that sometimes all of the data going into what we call a data lake becomes a data graveyard where there's not much that is put together or analyzed. So it's very important to take what is interesting and turn it into what's actionable. So what I'm going to talk about briefly is how we're using subjective data, that is our experiences in working with individuals, objective data and insight from the person to identify factors that are causing poor outcomes and homelessness or housing instability. So we look at people who utilize emergency rooms or inpatient units, jail systems, crisis systems, and people who are using it very frequently. And quite often, we find that the usage is not appropriate. They're using those systems because that's the choices they have available to them. So we look at people who are high cost. We find gaps in care. We find social determinant issues, which you'll hear more about today. So the logic we use is we look at the data of, okay, people make choices. Choices make patterns. Patterns reveal preferences. And it's much like Amazon knows what your favorite author is. But we also know that someone is doing something repeatedly, and there must be some reason for it. And frequently what we find, and sometimes we're sitting, everybody knows Maslow's hierarchy. And Maslow's hierarchy, basic physical needs, safety needs, social needs, and all the way up, right? So most of us in this room are sitting pretty high up on that pyramid. And we're looking down at people and thinking, wow, why would you go to an emergency room 90 times? And thinking, wow, that's totally irrational. I wouldn't want to hang out in an emergency room. I wouldn't go to an inpatient psychiatric hospital. But when you look at the pyramid and you flip it upside down, the amount of choices each of us have in any circumstance, whether we have a headache or a stomach ache or ill, is immense. Oh, we have a social network, we have finances, we have transportation, we have all those assets, right? When you look down at the bottom of the pyramid, it's a choice they have to make between a survival choice. Their choices are, I'm from Arizona, I sit out in 110 degrees with no food, or I go to an emergency room where people are kind of nice to me, give me a sandwich, or I put myself in an inpatient unit because I'll probably get a shower, I'll get a clean bed, and I'll get some food. And in some of our hospitals, there's a swimming pool. So I sat out with a group of people that were the high utilizers, and they really had almost a Trivago of the hospitals. Well, this hospital has the best food. Now, this hospital has the best pool. And that utilization of resources is just they're human beings like us making decisions on the limited choices they have available. So the job is to give more choices early on, or if you know the person's making those kinds of choices, to work with them and introduce them to alternatives. So big data is interesting, merging big data into analytics is you don't want to see how we make our sausage, because we are combining things that, sometimes, like, how does this fit that? And so we are using data to solve problems, and using the Toyota why analysis. Like, if you go why, you eventually come down to, here's why you're doing it. How about if we give you another choice?
Yeah, yeah. Thank you. Thank you for making Thank you for making the explanation of data come alive with the reasonable, and to those reasons too. The emergency room is open after 4 o'clock in the afternoon, at all times, which a lot of services aren't, and there's a huge cost component to this whole thing, because we could offer many more choices rather than pay $150,000 a year for all of those hospital visits.
Well, you know who else is open 24/7? The police.
Perfect lead-in. Thank you, Dr. Franzak. Sheriff Barnes, as Sheriff of Orange County, you oversee a large population of individuals experiencing homelessness. How large a role does the homelessness or the housing shortage play in the crises that you see on the street on a daily basis?
First, thank you for the opportunity to be here and for taking time out of your day on this very important topic. Just like Dr. Franzek has said, several things that place me in a very unique position. And I use the analogy on this crisis. If you remember when you were kids and you had dominoes and you stood them on their end and you tipped them, I'm domino 40. I'm not domino 1. The 39 dominoes before me aren't there, and we're building that system backwards. So, yes, there is a default in the system. It's not by design. Many of these people who are struggling eventually end up into my care. I run the largest mental health hospital in Orange County, the Orange County Jail. I have, on any given day, 2 out of 5 people have a daily nexus to mental health treatment. Over half my population has an addiction issue. And minimally 1 in 10, probably as many as 2 in 10, have self-declared homeless in those who are entrusted to our care. So it's a very complex issue on how we resolve this. Not to repeat everything that the doctor had said, but he is absolutely right. I recently testified on the President's Commission on Law Enforcement and the Administration of Justice on a subcommittee, Social Issues Impacting Law Enforcement Subcommittee, and my quote that I led with was, the first face of government somebody sees when they're in crisis should not be somebody wearing a gun and a badge. And those off-ramps have to be built out. The Desmond Tutu, why are they falling in the river? And what stopgaps can we provide to help stop the population from growing? We have to have stopgaps. We can't just look at the outcome, the end result, and when somebody gets into homelessness and start trying to solve that problem. We have to go upstream. And what I mean by that is, in my opinion, and I have 40 deputies, by the way, that do nothing but behavioral health outreach within our community. I have another team of deputies in my jails who do nothing but behavioral health outreach within our jails with clinicians and others. And what I mean by that is we have to be able to identify where the gaps are and plug those holes. I do not believe that people became homeless and then became mentally ill, or became homeless and then became have substance use disorders. Homelessness is a manifestation of other failures within the social system that we have to be able to address. And we're doing a really good job in Orange County working that problem backwards, but it takes a lot more holistic approach to get out of this. I recently was speaking to some members of Congress on some legislation, and I made the comment to them on 2 fronts. One was on use of force, police use of force. Keep in mind that these issues, they're not law enforcement issues to resolve. All the interventions that should be there have been non-existent for decades. And they're falling on the shoulders of law enforcement to deal with, because we're available 24/7, 365. And people call when they're in crisis, and we are dealing with them. And we're doing a really good job of doing it, but we're not professionals. We're not clinicians. I made the comment to somebody when they're talking about use of force legislation, training for law enforcement. I said, I can reduce use of force by 50% right now, get us out of social work. because 50% of the use of force that my deputies encounter with the public is somebody in crisis. Somebody's mentally ill, somebody's homeless, somebody's addicted or experiencing narcotics issues. If we can resolve that issue and go upstream, as Dr. Franson said, that's a very clear 50% reduction. And I believe if we deal with these issues upstream, I can reduce my jail population by minimally 25%. Minimally 25%, probably as much as a third, if we get people into services prior to them entering into the justice system, which is a default of them committing oftentimes minor violations of law because there isn't any way to off-ramp them. And we're getting much better at the off-ramps. We're building the systems out. I think there's other questions you'll probably ask me, so I'll probably stop there. But I want to put myself out of the business of being a social worker. It's just not what we are intended to do. The 3 tenets of policing is crime prevention, apprehending criminals who violate the law, and order maintenance. Those are the 3 tenets of policing, not law enforcement. Law enforcement is a 1980s label that's been placed upon us. We are in the business of policing the community, keeping order and crime prevention.
Thank you. I just have a follow-up to that. Are you currently involved in partnerships with the community in terms of these upstream issues that you described?
Boy, am I. I am, and I do more social work and probably planning. It's been several iterations over the years. You may have heard of them. It started with the Stepping Up initiative that was a national movement dealing with those in mental health crisis. When I took office in 2019, I took that as a priority of mine from the county that then transitioned into the integrated services plan, which was really a concerted effort. I have one advantage that others don't. We had an offsite back in 2019, got everybody who was a mover shaker who could help solve these problems, locked them in a room. I said, I'm not letting you out. I have a gun, you don't. We're going to solve this problem. And we did it in what I believe was a very non-political way. I know by default I'm the P word, but I'm a peace officer at heart, and I want to be a problem solver. And that became what led into then the integrated services plan, and now it's integrated into the 3rd iteration, which is OC Cares in Orange County. It led to the Be-Well campus that we built in Orange, opened up at the beginning of last year, and leading to the 2nd Be-Well campus, which it will be in the city of Irvine on property owned. I was on the Commission on Homelessness. I'm on United to End Homelessness. I'm on the Orange County Housing Finance Trust. I'm the county coroner. In addition, I just commissioned a panel to look at causal factors leading to homeless deaths in Orange County with the intent of finding gaps, seeing what's working, what's not, find ways to connect people to services in ways that we may. If people are being contacted 10 times, why aren't they accepting services? Eliminating those barriers, whatever they may be, because these are very high-risk populations. To make that happen, as well as numerous nonprofits, community-based organizations, and others that we are training, faith-based organizations, for example, training them on how to deal with people in mental health crisis through our department. All my deputies are trained in crisis intervention, CIT-1 minimally. The deputies I have assigned to behavioral health units are trained in CIT 1, 2, and 3. The highest level is 40 hours of training and intervention.
CIT.
Crisis intervention training.
Right.
To make sure that they're interacting with this very high-risk population, because we want to connect them to services and make sure that we get them into programs. I think one of the greatest opportunities, and this is just, I think, the influence of the office of the sheriff, not me personally, but the access I have to others and talking to some of our congressional leaders. And one thing I've been trying to resolve is the Medicare Exclusion Act. And what that means is when somebody's in custody, they cannot benefit from these services. It also means that they can't get connected to services and oftentimes walk out of our jails without being attached to sustained success. And we are working towards the ability to sign people back up to Medicare so that when we have a warm handoff to people in the community, we're reconnecting them back into medical, because they oftentimes have that gap where they're walking out. And people with, for example, who are receiving medication, when they leave our jail, we give them 2 weeks worth of medication when they leave. So there's a gap to provide that. And every one of these people that we can connect to services and keep them into sustained success is a win if they don't come back.
How refreshing is that a sheriff in uniform is talking about the Medicare Medicaid Act. Wonderful. Just one more question about, you mentioned the integrated service plans in this collaboration. Could you just explain what that is?
Sure. The integrated services plan was really, so when the doctor was talking about dealing with root cause analysis and problems, and you can't do those one at a time. It's not like we're not looking at it through the same lens. And now we have a triage or saturation model. When somebody is in any one of the components of our system, we look at them holistically. They may be a veteran, they may have mental health issues, they may have a substance use disorder, they may lack housing, they may need employment, whatever that might be. And you don't put them on an assembly line and deal with them one at a time, because if any one of those processes fail, with this very high-risk population, for those that don't know, it takes minimally 9 consistent contacts or outreach efforts to establish trust with this very high-risk population. And if we fail them in that system, it's very hard to get them to re-engage and get back involved. So we triage them and saturate them. Just like if they went to an emergency room, you don't take their blood pressure and then move them down a line. You look at everything at the same time. I think that's the most important part of the integrated services plan. But also on the data front that the doctor mentioned, we have an integrated data strategy in Orange County. There's 34 cities in Orange County. I patrol 13 of the 34, and there's 21 municipal agencies. And when I talked to them back, this is going back to 2017 when we started taking on the Santa Ana riverbed, if you remember that crisis on the riverbed. And I went to my peers and said, we're going to resolve this issue, and we're not going to punt the problem. We're not going to squeeze the balloon. We're all going to equally own it and stop shifting this population around. And we looked at it through a different analysis, which is it's all of our problems. It's not a Santa Ana problem or a Sheriff's Department problem or an Anaheim problem. We have to just look at the population as a whole and start saturating them. And part of that data crisis, part of the trouble with data is a lot of the data we have is protected data. CJIS, for example, the Criminal Justice Information System, is protected data. You can't see crime data. And I can't see HIPAA data because it's protected for different reasons. But we can aggregate that data in a way about a person and wall off the protected portions of it and look at an individual and find out who the highest utilizers of government services are, who the people are that are 90 times in a hospital, who the people who transition through my jails 10, 12, 15 times a year, and start to look at that high-risk, high-utilizer population based on the Pareto principle, the 20% that take up 80% of the resources. If we can get that 20% resolved, that's a huge relief on the system. I think it's most important. So data integration is key to be able to look at data.
Right. Thank you. Thank you. Heidi Marston, could you tell us a little bit about the work of the Los Angeles Homeless Service Authority, and also what your sense is of the public's awareness of the role of housing authorities in homelessness?
Sure, absolutely. So LAHSA, Los Angeles Homeless Services Authority, we're a joint powers authority of the city and the county of Los Angeles, and really charged with overseeing the region's response to the crisis. On any given night in Los Angeles, there's about 66,000 people who are unhoused. So as you could imagine, not only the volume is high, but also the geography. If LA County was a state, it would be the 9th largest state. So our response to the crisis has to be tailored not only to adjust for scale, but for scope. The way that you look at homelessness services in Antelope Valley is different than you would look at it in downtown LA, for example. So our job is really to coordinate all of the services, to work with our nonprofit partners who are doing the work on the front lines to the best of our ability, row in the same direction so we're not working across each other. So that's really our focus as LAHSA in LA, and both us and our housing authority, who receives a lot of our federal resources for housing, work very closely together. And I think that's something that we've really tried to pin down in Los Angeles. So I started at LAHSA as ED in 2020. I've been there since 2019. And we quickly realized that we're getting all of these resources that are coming to LA from the federal government, the state government, even the local government. But we weren't seeing it move the needle in the way that you would expect. And so we said, what if we created a central command model that took all of our partners, our housing authorities who get Section 8 vouchers, our non-traditional partners, our hospitals, our providers, and tried to work to put all of those things together. So we had a more streamlined process. And so what we saw is when we were able to combine our resources and really braid all of the pieces together. So if the housing authority's resource only takes it 50% of the way, but LAHSA has something that can take it the other 50%, let's be more intentional about how we use that. Because what happens in a market like LA is you get housing vouchers that are worth about half of what it actually costs to pay rent in Los Angeles. And so it means those resources go unused and they get returned, which you never want either. So we have to figure out that balance of leveraging the local resources that LA is grateful and lucky to have. Not every local jurisdiction has the investments like LA does, but I think without it, we would be in a different scenario. And what we're seeing year over year, whether it was during COVID or even last year, 2021, we're housing 21,000 people every single year as a system, and still there are more people falling in that are becoming housed. So we are learning how to braid everything together and leverage the resources we have. But I'm really heartened to hear all the discussion today about systems and about, the bigger picture here, because it is the responsibility of LAHSA and nonprofits to piece together what we have, but it's the responsibility of the larger systems to stop people from falling in the river, to stop the inflow in LA, which looks like every single day, 205 people are placed into housing, and every single day, 225 people fall into homelessness. So we have to right-size that equation.
Thank you. How do you coordinate the housing piece with the services piece, or is that done somewhere else? How does that work? How's that coordination arranged?
Yeah, so LAHSA receives about 38 different kinds of funding. We try to package it together and give it to our nonprofits in the least administratively burdensome way as possible, because they need to be out doing the work. So we have a scale of intervention. So at the furthest end, for people who are chronically homeless, who need permanent support, you have sort of the platinum model of permanent supportive housing, which means we give you a unit, we give you the wraparound services, maybe for the rest of your life, and that you are set. That's a smaller percentage of the population that actually needs that level of intervention. So we've done a lot of work to think about, like, what is the least possible intervention we could give somebody so that they will be successful, and we're saving those resources for those high utilizers, for the top 20%. So we've created a scale of programs that will supplement your rent. So it starts by paying your rent for a couple years and then slowly tapers back as you get back on your feet and get more income. I would say one of the most innovative programs we've implemented in LA and is now kind of taking off across the country is called problem solving. So this idea that we have so many people coming to our door because, like ERs or even policing, the homeless services system is the safety net of last resort. You don't come to our front door unless every other system has failed you. And so the best thing that we can do is try to keep you out at all costs, because we know bringing you in is going to cost more, and it's going to cost more not only financially, but on your life and your outcomes. So problem solving says, let's make sure we've worked together to exhaust every single option available to you before we just take you and put you in shelter and put you in the queue for housing. And what we've seen is by creating a flexible pool of funding that can plug in, sometimes people just need new tires on their car so they can get to work. And we were able to do that instead of moving them into shelter and perpetuating homelessness. Sometimes people just need help getting back home. Sometimes they can live with grandma, but grandma can't pay utilities, so we'll take care of that for a few months for you. But what we've seen over time is last year, about 10,000 households came through that program. Only 30% actually needed financial intervention. The rest of people who were placed into permanent options just needed help thinking through everything else that's available, because as you've heard, experiencing homelessness is traumatic. People are actively experiencing trauma. You are in crisis. And so having someone who can sit down with you, you have trust with, and can take the time to build the relationship and problem solve with you is showing better outcomes than I think we even anticipated when we launched the program. It's not always about the funding, it's just about helping you put the pieces together.
Thank you. Great. All right. So it's a huge system that you're describing. I was particularly struck with this information about the number of people going into housing and then the number of people falling out of housing, and the wrong number is in place, higher. And I just wonder what your thoughts are about that and what interventions you think might be effective in changing that balance.
Yeah, so I think problem solving is a piece of it, but really, by the time you're hitting the problem solving door, you've exhausted a lot of options and you've fallen through the cracks quite a few times. I think there's a number of things. So we did a study in LA that looked at our Department of Mental Health data, our County Health Services data, and all of our homeless services data to see who was coming to our system and do we know who they are. And what we found, and it's a California Policy Lab report that you can go see online, but 90% of the individual single adults who were unhoused in our system had been through some other county system at some point in their life. So child welfare, mental health, physical health, incarceration, whatever it is, we knew who they were. So that tells us that we can build tools to potentially be better at predicting who is the most likely to fall through and wrap services around them earlier. So I think everything that's been talked about here about moving upstream, about holding those other systems accountable, from people just need a place that you can afford to live. In LA, I think you have to make now 2.5 times minimum wage to afford a 1-bedroom apartment. So that's pretty basic math, but at the same time, we also have ways of understanding through data who is more likely to fall in and potentially prevent it. So I think it's both very just deliberate fixes to those fundamental cracks of housing and cost of living and wages, and then using the tools and data that we have to look at it longer term.
Thank you. There's a question from the audience, which is for you, which is, when talking about homelessness, because I know you coordinate the point-in-time count, when talking about homelessness, are we including people that double up or only the individuals that live on the streets?
So when we talk about homelessness, we use a few definitions, but I guess maybe it's easier to say what we don't include. So we're not including people who might be couch surfing. We're not including people who are housing insecure. You see this a lot in the youth populations or in students. We're talking about people who are literally experiencing homelessness, who are sleeping in their vehicle, sleeping in makeshift shelters, or sleeping in a shelter that's built by our system. So all of that to say, 66,000 people is a ton of people, and it's probably just the tip of the iceberg at the number of people who are at risk or one crisis away from becoming homeless themselves.
Yeah, thank you. And Sheriff Barnes, there's a question here for you. It's a little political. It's from the audience, and I'm obligated to ask it. Are you pro or con sober living homes? Please note, sober living homes require psych med compliance and sobriety.
So that's a very complex question because sober living homes fall under different definitions based on the size of sober living homes and how they operate. So if you're under a certain number within a sober living home, you are protected by ADA. That's probably one of the first major obstacles because there is a criminal enterprise that exists within sober living homes that's taken advantage of. We're known as the rehab Riviera. People come from all over the nation and oftentimes get curbed. If you know what curbed is, it's being kicked out of a sober living home for non-compliance or failing. And when I say there's a criminal enterprise, I'll explain it this way. People are taking advantage of the insurance that somebody might have. It usually lasts about 8 weeks. They get them in the program. They fail them out. You can tell who fails because the people who are walking down the streets with luggage, for want of a better term, and oftentimes they get recontacted by another kind of coyote, if you will. They can't get into a program unless they have a dirty drug test. They reintroduce them back into narcotics in a motel, and oftentimes young ladies get sexually abused during that process, go back into sober living home number 2, and start all over again with this criminal enterprise of really insurance fraud. That I'm against. I cannot be any more clear. I'm against that component of the illicit sober living home trade. There are legitimate sober living homes that operate very professionally and ethically, and I think those are the ones we need to support. We need to off-ramp people and connect them to services, and those, and I know they're there. They operate in the shadows. Oftentimes they're in communities people don't know who they are because they do it in a way where they reintegrate people back into the community. So those, I think, we need to be more supportive of, and programs like that. I run a MAT program in our jail. It's medicine-assisted treatment for opiate addiction. And any given day, I have between 550 and 725 people in MAT. And we have a warm handoff where we transition them out of our jail, hopefully into the arms of somebody else for sustained success. But that has to happen in a program like a sober living home environment for them to sustain that sobriety, connect them to services, get them to employment, get them to housing, whatever that might be. And that process I'm absolutely in favor of.
Thank you. Thank you. And you answered the second question from the audience, which is give us an example of referrals and assistance you do to help people get back into the community with your MAP program. So thanks for that. I want to ask Dr. Franczak a question that is very controversial in California right now, and because you're from Arizona, you're safe from the fallout. But I'll ask each of the panelists. Right now, there's a huge debate at the state level around this proposal from the governor's office called care courts, and it's essentially I don't know how you would describe it. It's basically involuntary treatment for people who refuse an invitation to go to treatment voluntarily or to go to a shelter. So if you're on the street and you don't think, I won't editorialize. That's the proposed plan. What are your thoughts about that kind of proposal? Have you seen it work in Arizona? Have you seen it work anywhere? Pros and cons on that issue?
Well, there is a movement for what's known as assisted outpatient treatment. And Arizona has already had that. But that isn't the same thing. That is that an individual, after they're discharged from a hospital and have a court-ordered treatment, they have to follow some rules, medications, et cetera.
Right.
And
post-discharge.
Post-discharge. But it's not the same as what you mentioned, which is sort of a pickup. You don't want to agree, so we're going to commit you to do it. And I haven't seen that exist anywhere, at least in the United States at this point in time.
Okay.
But there are individuals, and there is a slice of that 20% that do not want our help and that are consistently saying, leave me alone. Now, in Arizona and most other states, those people could be left alone if they weren't causing harm to themselves or others, or persistently disabled so that they were going to refuse to eat or things. But that is reserved. That restriction of rights is reserved to only that population.
Okay.
I haven't seen it anywhere else.
Yeah. Heidi, any thoughts on that?
I think that's right. In terms of making it, there is a very small percentage of the population who is very, very sick. And I don't think it's any debate that the mental health systems in this country are failing. The way that we've designed mental health, you can't access mental health same day unless it's a crisis. And, even if it is when people are having active mental health breaks or they're in psychosis, there is nothing other than the police right now that can go and assist them. And whether they're dangerous to themselves or others, whether it's, I live in downtown LA, and there was a woman the other day right across the street who was walking around just without any pants on for days. And I thought to myself, if I can't help her as the person who is overseeing LAHSA and the homeless response system, I don't think the police can help her, because what tools do they have, then who? So there is that question fundamentally we have to answer in this country. It's possible that the care court model could be a way to keep people out of jail for a very small portion of the population. At this point, because of how big the gap is and what the need is and what we have, I'm willing to give anything a test as long as we don't use broad strokes. But I think the more that we're really focusing our interventions and our investments on mental health, the better we're going to be in the long term, not just for the top 20%, but for everybody who is unhoused.
Sheriff Barnes, I'm interested in your response.
All right, I'm going to rapid fire my answer because I have too much to say on this. First, I think, and I know the last question you classified as being political. The care courts are political. It's a political response to a statewide crisis without the framework to be successful. When you look at what we're facing, we have the Boise decision, for example. I think this is going to be tested and found unconstitutional because of the Boise decision that restricts us from enforcing status violations of homelessness, which is really what a lot of these things are. I can tell you there's other ways that can work. I mentioned our B-Well campus in Orange County. My deputies have deferred to date over 400 people who would normally be brought to Orange County Jail to the B-Well campus, and upwards of 90% of them have been stabilized in a way that they're not re-entering back into the system. So there are different and we are deep in the collaborative courts in Orange County. One of our collaborative courts just got a national recognition, one of only 5 courts in the nation. That's homeless court, drug court, adult court, whatever it takes court, veterans court. I have a veterans unit within my jail that I run just for, it's called Humvee Housing Unit for Military Veterans, that we are addressing those individuals who served our country proudly and fell a little short after their service. There's a lot of strategies that will work. Coming up with a political, nuanced solution in political times, election year, is not the solution without the framework to make it be successful. You can't just push this onto locals and say, this is what I'm forcing you to do without having the framework to be part of, to solve the problems. It's an output, not an outcome. We need things that are outcome-oriented, not just throwing resources at things that aren't designed or set up for success.
Thank you very much. One of the themes of today is messaging around what can we do on an individual level, given the enormity of this problem and the complexity of things. Every day we walk by people who are homeless, and I think this is something that doesn't get talked about enough, in the sense that we talk about all the distresses that people who are homeless have. But I think just the average citizen, you're walking down the street with your kid, we're in Disneyland here, it's like kids everywhere, and it's alarming to see a homeless person. For us, blood pressure goes up, like, you don't know what to do, give money, no, look away, are they in trouble? It happens very quickly, and then we're walking by, some decision is made. Your kid is like, how are we passing by this person and leaving them there? So it's not as if homelessness is about that. It's all of us. It affects all of us. And I guess the question is, like, what are your thoughts or suggestions or calls to action? What could we do, even at a small individual level, to begin to address this? Mike, I'll start with you.
Yeah, I think...
You have to use the microphone, I'm sorry. California.
I'll get it at some point, but I think...
Involuntary microphone use.
There's no question that in looking at individual cases that we do, we take big data and turn it into individual data, do a functional analysis. One of the things is to prevent them getting into that system, just like you're saying. We see a lot of people coming through evictions. And when we look into, okay, what's going on? Is it money? Oftentimes they didn't get the supports to be able to live in an apartment setting. And so it's the availability of having flexible supports. There is a model that was started in New York called critical time intervention. It was started at New York Presbyterian. That is really very effective in getting people to successfully integrate back into the community from jails and or hospitals or from homelessness. I don't know if you're familiar with that work, but we have tried it, and we have about an 87% success rate of people transitioning. The other thing is, somehow, at this point in time, I think the Illumination Foundation and a study we did with Arizona State University showed that it is financially and clinically successful to do this. The Illumination Foundation data showed like a 30% reduction in overall cost. Our study showed a 28% reduction. And, to get the ear of some legislators, you got to show them the money. Because, doing good is, everybody likes to do that. But they're concerned about other factors as well. So right now, I think we're not in a perfect storm. We're in a perfect sunshine. We have a lot of people interested in doing something about this. We have a lot of money coming in through ARPA. We have a lot of people with compassion in this room that would come to a conference on this subject. I think we can make a difference in a person, one person at a time.
Thank you.
I would say on a personal level, individual level, don't ever take for granted who you vote for, who you elect into office, the people who are going to do the bold things and take the bold actions that are needed. As much as California locally does, as much as the city of LA or the county of LA does, they were never designed to address this crisis. You have to go all the way up to the federal level and hold those leaders accountable too. So on an individual level, vote for those individuals and support those policies and push them to do those things. I think the other piece that this panel hasn't really touched on yet is just the reality and the role that systemic and institutional racism play in this crisis in the first place. And until people with privilege and people with power that is greater than people who are unhoused, so everybody here is willing to actually lose something, to check our own biases, to actually push something that might make us uncomfortable, I think it's going to be difficult for us to make movement. So my personal challenge that I challenge myself with is think about how you are reinforcing systems that don't work. Think about decisions that you're making that are keeping people trapped in the systems that we have. And even if it's the smallest little thing, it makes a difference towards the greater good of solving this as a society and not just as one community or as one city across the country.
Thank you. Sheriff Barnes.
I love the comment about the politicians, and I know that's me, but I don't take that personally. And I'll tell you why, because
there's good ones.
when we were taking on the riverbed, I was actually running for office, and I had my consultants telling me, "Don't do this; it's a political hot potato." And my answer was, "No, it's never the wrong time to do the right thing. We need to address this population." I saw more politicians. I saw more politicians in the 11th hour when we solved the problem than I saw with me at the beginning of it. And that just goes to show you how some people think. I think the biggest thing we have to deal with are two things. The YIMFAs, yes, in my front yard. You can't say, no, not in my backyard. You're saying, yes, in my front yard. It's got to be okay or not okay. And I think to do that, you have to, like this, a great forum, have collaboration, get people together in the same room. When I was addressing that issue on the riverbed, I had numerous nonprofits come to meet with me. And about the fourth or fifth one, I started laughing. And they said, "What's so funny?" I said, "You have to understand what I'm hearing. Because every one of these nonprofits, I'm not pointing fingers, but you're operating in self-preservation, independent of all the other resources that are available laterally. You need to look laterally at the problem and find out." And I told the story this way. If you're old enough to remember The Miracle on 34th Street, that was a movie back in.
I love it. One of my favorites.
Miracle on 34th Street.
I noticed you didn't say that to friends.
I told them, I said, I want the Macy's Santa. I want the guy that goes, "I can't help you, but if you go to Heidi, she can provide the services you need." Start looking at this laterally. And this is really a call to action for everybody in this room today. You should walk out of this with at least 20, 25 business cards in your pocket of people who are thinking like you, pulling the rope the same direction, that you can build synergy with. Because this is not a one organization, one person problem. It's a community problem to resolve. And we have to pull the rope the same direction. And most importantly, to go upstream, we need to stop creating new homeless people. When I was on the commission in homelessness, there were 10 initiatives. And when we introduced those, I said there's two that are very clearly missing. First, the people who are becoming homeless. How do we stop them from becoming homeless in the first place? You have to have a stopgap so that you start bringing the population back down. And my other one, which is something that's endearing to me, is the foster age youth. When people leaving foster care, how are we setting them up for success? Because they're oftentimes counted as a number and not as a person. They get introduced into the adult world, and they're not prepared for it, and oftentimes become our youngest homeless people, sex trafficked, and part of the criminal element that they're subjected to for self-survival. We need to deal with those two populations as well, and everything else. When I talk about the 20%, or Heidi said the 20% that we see, these are people with names. They have families. We walk by them on the street and we see them as tangible things. We don't see them as people anymore. Mike, the guy who's right in front of my office every day, Mike's from Fresno. Mike has a family. Mike has challenges, but Mike is Mike. And I asked my staff one time, can you tell me about Mike? They had no idea what I was talking about. They knew who Mike is now because I took time to get to know Mike. What I didn't do is perpetuate the problem. I'm not saying that you starve them out of homelessness or you make them poorer. Most importantly, you got to give to the services that are in the business of getting people out of homelessness. You don't do that by handing them $10 in the corner or handing them a box or something to eat. I'm not saying that that's not the right thing to do. But for the faith-based organizations, I see them doing this over and over and over again. We're going to give you a tent. We're going to feed you 3 times a week. We're going to give you some money or things. And that's okay, but it doesn't solve the problem. It perpetuates the problem. You need to support organizations like Illumination Foundation and others like that, other nonprofits in the room and faith-based organizations. You start collaborating to solve the problem long-term, not short-term solutions that just perpetuate homelessness.
Thank you. Well, our time is up. I want to thank the panel for their wisdom and insights. And thank you for your participation.